the meeting recording pop up. So with that being said, I want to go ahead and kick off the meeting and say hello to everybody and thank you for joining our interested parties engagement session. This session will focus on supportive skill building services for section policy 12, 18, 19, 20, 29, and 96. Next slide, please. So I want to kind of go over quickly the supportive skill building services definition, as again, our focus today is going to be on the activities and codes related to this. So supportive skill building services are aimed at advancing independence through instruction, training, skill building, and equipment. And I wanted just to review that because those are the servicing codes which fall under policy section 12, 18, 19, 20, 29, and 96 that we'll be focused on today, and our questions will be surrounding. Next slide, please. Okay, so the current supportive skill building services codes we've identified with the assistance of main care are displayed on this slide. There are 5 codes total for this section of policy, and they're 98960, 98960, of course, with different modifiers, and H0045, H2014, and T2040. And we, again, just want to show this particular slide. So when we're talking with some of the questions, and you guys might have feedback or information you want to provide, we're thinking along these lines and these codes that we're wanting to try to get additional information about. Next slide, please. So with the quick overview we just had, we want to, again, talk about the agenda. So during the next 60 minutes, we'll quickly review the rate determination process, the project overview, goals, and activities, and then get into the questions and opportunities for discussion and feedback. Next slide, please. So today I want to introduce there's some of us on the PCG team here, which is Public Consulting Group. Myself is Rhonda Kern-Strelzer. I'm a senior advisor of behavioral health and a lead for interested party sessions. Emma Finestone, project lead and senior consultant. Maddie Wall, business analyst. Jonathan Sauershow as a senior consultant, and Caitlin Crone, she's also a senior consultant. We also have some of the main care team on the call today. I'm going to turn it over to Kristen.
Thanks, Rhonda. Hi, everyone. Good morning. Thanks for joining today. My name is Kristen Merrill. I'm a senior policy manager with the Office of Main Care Services, and I am what we call the executive sponsor on this effort. On the main care team. I'm joined by my policy colleagues, Tom Leet, who is the long-term services and supports manager under the main care policy team, as well as Heather Bingalis and Megan Brooks, who are policy writers under the long-term services and supports team. I'm going to pass it over to Dwayne.
Hello, I'm Dwayne Parsons. I am the manager of rate setting. I'm joined by the rest of the rate reform team under rate setting. The rate reform analyst, Jessica Levesque, our HCBS rate reform analyst, Jennifer Morse, and our rate setting coordinator, Amanda Lee. And I'll pass it back over to Rhonda.
Thank you, Dwayne. All right, so let's go to the next slide, which is actually the rate determination process overview. Next slide, please. So while this meeting focuses on feedback from participants regarding supportive skill building services, I want to highlight process. Let's see, I think there's a couple people. Maybe it doesn't have mute. Okay. So again, I just want to highlight the process from a few slides on the kickoff call that we originally had back in August. The rate reform process sets schedules for regular rate reviews, benchmarking, creates a transparent process, and includes technical advisory and comments. So, and this just highlights that as well there. Next slide, please. So steps for the rate determination process include a kickoff call, which again, I mentioned was held in August. It's actually August 28th of 2024. And that can be found on the rate reform website. And we will put links in the chat as well if you want to go back and review that or any of the other calls that we've had. It also includes public forums for feedback, official written comment period, which we will discuss or provide those dates in the future of when that's going to happen. Department review and final rate determination, which should be around April of 2025. During this process, PCG will hold and conduct interested party sessions, collect data and complete analysis. We'll develop rate models, draft rates, and make presentations for comments. We'll finalize rates and publish and make final recommendations for considerations for rule proposal and adoption. Also, I do want to highlight and review a few items from the interested parties engagement standpoint. These meetings that we've had currently right now ongoing, as well as the ones we've had previously, and we have a couple more scheduled as well. They're those kind of general meetings to get us started gathering information. We do anticipate further meetings in the future with additional focus items and a survey to gather more feedback. And that information or opportunities to provide that feedback will be sent out via the listserv. And I do believe we will provide that in the chat as well. The link where you can go or sign up for the listserv if you're not on that. And then in addition, we also have an email set up that you're welcome to send information, questions, or comments to. That is something that for this particular project. And I believe Emmett has just posted a couple things in the chat for the dedicated email and some other links and screenshots for our meeting sessions. Next slide, please. So, following those established requirements for the rate reform process, this project focuses on the supportive skill building services, and primarily the home and community-based services, including assistive technology, devices and services, care coordination, clinical services, clinical therapy services, supportive skill building services, which again is today's focus, therapeutic interventions, and personal support services when you look at the whole entire project. I do want to note that other projects are occurring simultaneously with partners and main care during the same time frame, which are reviewing other sections, payments, rates, and codes. So if you're not seeing a section listed here, please check with the rate reform website on other projects ongoing. Again, this section will focus on supportive skill building services. However, if you're interested in providing feedback on any of the other sections or services listed, we are having specific meetings for those that are upcoming. Looks like we have a couple more left at this point. Or certainly you can reach out to us via email as well. And then sign up for any of the other on stakeholder engagement sessions in the future. And then we will also put out communication through the emails with the listserv, and also the last few remaining dates we have. We'll put that in the chat as well. And then any of the previous sessions, you can go to the rate reform website. Next slide, please. So our project goals are to develop and document appropriate benchmarking, service definitions, rates, and coding alignment. Engage closely with interested parties throughout the project lifecycle, demonstrate the impact of changes to rates or service definitions, and then ensure alignment to state and federal reimbursement requirements. So those are really like the high level things that we want to make sure that we're doing in this project. Next slide, please. So this slide identifies some of the activities that we've done currently. We've identified codes and rates for each section, and the lists can be found on the rate reform web link as well. I believe in the chat that link will be posted as well, and you can see the codes for all of the projects and services for this entire project. We've been analyzing codes, identifying benchmarks for services, as well as looking at services without benchmarks. We're creating benchmarks with input from providers, creating assumptions based on best practices and national trends. So again, that's why it's important to get the feedback and why we also think there'll be additional sessions in the future. Throughout the project, interested party engagement will occur. And like I said, we will also send out information on when those opportunities arise as we continue throughout this process. Next slide, please. So again, the next slide is starting with our questions. We want to again identify, Emma, can you do us in the chat, send those codes back out just to refresh everybody again, what those codes are and what we're looking at.
Sure thing. I'll post those in a second.
Okay, thank you. And so when we're talking about the questions and potentially feedback from you, we're thinking about these codes. So with that being said, we'll go ahead and get started with our first question. So what concerns do you have about this rate determination process that you would like our team to be aware of regarding supportive skill building services? And this can be anything general that you would like to ask, or you can raise your hand. You can put information in the chat if you would like, or a question, or if you have a comment. We're certainly open to any of those options to give us feedback or ask questions or help answer something. So we'll give a few minutes and see if there's any concerns about this particular rate determination process regarding supportive skill building.
I think just to maybe prompt a little bit of feedback or questions from folks attending. Again, this question is meant to speak specifically to the rate determination process for these services. There are subsequent questions that talk specifically about components of the service, rate components, or things we need to consider. But specifically, does anyone have questions or areas they'd like to discuss surrounding the actual rate determination process?
Thank you, Kristen. And I will say, if we need to go back, there's a total of 5 questions. If we need to go back to questions or something's prompted later on, that's not a problem. We can certainly do that. Or if you think of something later on after we get off this call and you email as well, that is okay too. So I'll give another minute or so, and if there's anything anybody would like to bring up. I will say some of the other previous examples in some of the other sessions, people have asked about specific, state or federal policies or regulations or different things that what we would be looking at or things like that. So anything, it could be related or just any general question that you may have or concern. Okay. Well, if there is nothing right now, we can, like I said, come back. We'll just go to the next question and maybe it'll prompt some other things. Are there specific codes or rates for this rate determination process where you think changes need to occur for supportive skill building services and why? And again, we have put the specific codes in the chat so you can see those. I will say from some of the previous engagements, people have identified, a specific code that was not in alignment with other payers, or, a specific code that's being utilized that, the rate doesn't reflect the staffing, education requirements, things like that. So if there's anything specific that you would like to bring up regarding a specific code or rate, for this or for supportive skill building, please let us know and certainly would love to hear any feedback. Anything at all regarding the codes or the rates, maybe that are challenges that you're seeing or that you face when delivering the services and care to individuals.
I am curious, just given that we're not hearing any specific feedback related to coding or the rates. If there are others within your organizations that might have additional information, specific to alternative coding or rate components, and it would be useful to share that information from them. Please feel free to coordinate with them and send information to the email address that Rhonda and PCG outlined earlier. Additionally, if as Rhonda mentioned, we have enough time to step back to previous questions. So if you want to try to invite somebody else to the discussion to provide feedback, we would love that as well.
Thank you, Kristen. And with that being said, I will say from one of the previous engagement sessions, I did receive a question today, just this morning. So, and some other feedback that they had thought about later. So it's a great way to reach out to our team and provide information, or, ask questions. And, we'll certainly work with the main team and our team to make sure we get back to you and answer those questions, or, certainly incorporate your feedback if you would like to reach out via email as well. Even if it's a couple weeks after, it's okay. All right. Well, with that being said, we'll go to the next question. And like I said, we can hop back if we need to. Are there gaps in existing payment methodologies for this rate determination process to highlight for the team regarding or for supportive skill building services? And I think in some of our other sessions, individuals were talking about, how the current payment methodology doesn't align with the service delivery and what is happening in today's world versus when they were looked at previously. So there could be things like that. If you want to bring something up, it could be anything regarding that existing payment methodology and maybe challenges you're seeing or facing, or areas where you feel like there's a gap that we really need to look at. Because, again, for our team at PCG, that's one of the things that we are wanting to hear from providers is, where are areas we really need to focus, or, challenges you're facing that we can look into. Are there any gaps or challenges in existing payment methodologies that you want to bring up? Please feel free to raise your hand or put it in the chat. Oh, I think we just have something that popped up in the chat here. Do we know what the limits are going to be for consultation services such as G9007HI behavioral consults? In my experience, the hours annually do not cover what members need. If we don't know now, is this going to be looked into? So I can say, you know, behavioral consults is one of the codes that we are looking into. This specific code, and Kristen, just correct me if I'm wrong, I do not believe it's under this, correct?
Correct.
Okay.
We've included that under the clinical therapy services study, given that it's a behavioral health consultation. But Tammy, if you want to go ahead and send that comment to the email address that was provided earlier in the chat specific to that clinical therapy services study, we'd love to have that comment and question on file.
Okay, perfect. Thank you, Kristen. I appreciate it.
And thank you, Tammy, for being the first person to ask the question, and we do appreciate that as well, because sometimes that generates other things. Or if you have other questions or something you want to go back to, please feel free to type it in, or come off mute and ask as well. Is there anything else regarding gaps in existing payment methodologies, or as Tammy brought up, a specific code that you have a question about? We can certainly add that to the list or place it in here as well, and make sure that your question or concerns are identified.
Would it be helpful to folks, attendees, if we jump back to the slide that contains the codes and services that are part of this particular study? I know it was posted in the chat, but just in the event that folks would like to see it on the big screen, would that be helpful?
I think it might be helpful, and I know me, like many others, I'm fairly new to this side of the process, so I'm still trying to kind of soak it in and figure out what I'm going to be looking at, what I need to look at, who I need to talk to in my agency that has potentially more experience in this. So, and I know it's hard for people to speak up having been on the other side of the coin. So that's just from my point of view, is I'm just trying to wrap my head around all of this and figure out what questions would be appropriate, what I really need to ask, or who I need to bring into the conversation from my agency to kind of figure out what questions we really need to ask and what we're wondering about. So I hope others will definitely speak up as well.
Thank you
Thank you.
for that, Tammy. And again, just for folks, as as Rhonda mentioned earlier on in the presentation, there are additional steps as part of this rate determination. And so PCG and the department will be sending out a provider survey as well. So that will contain specific questions and asks of folks within your organization. So hopefully between today's engagement session, and the email address and the upcoming components of the rate determination, there'll be ample time to identify, all of the most appropriate contacts within your organizations or agencies to be able to provide that feedback that's going to inform the studies. But if we could just, I think Caitlin is running the slides. If we could just jump back to the slide that contains the table of service codes, just so folks can see that in real time. as we're considering the questions. Thank you.
The other thing is certainly the descriptions are identified here as well. So with the falls management, chronic disease management, respite care, not in the home, skills training, and financial management, thinking about those types of services and what staff are delivering out in the field. Is there anything that you're seeing a gap in, or things that you feel that are challenging, or maybe are not um, you know conducive to the services that are being provided for whatever reason, or is there an opportunity or something we need to look at here that maybe is not aligning with other payers or with what is actually happening out in the field? Okay. Well, again, we'll leave this up. Emma, if you could also put it back in the chat just in case we can come back to it. We'll go to the next question. And then, if we need to, again, I didn't pull this back up, we can. That's not an issue. Or go to another and back to another question. So Caitlin, can you go back to our next question? What do you think is most valuable for our team to know regarding supportive skill building services for this rate determination process? And in one of the sessions, it came up that one of the things that they really wanted us to know is case management is different than care coordination. And so, there are things, in the service delivery that maybe you feel like you really want us to be aware of, or something that is very distinct about supportive skill building services for our team to think about when we are actually, looking at the codes and looking at the services and the rates and all those sort of things, the service definitions. So maybe that might be an example of something someone wants to share and say, hey, I want to make sure that you guys understand supportive skill building is this, or it requires that, or something. Is there anything that if you were telling somebody, on the street, or a lay person saying, hey, we do supportive skill building, and they are like, well, what is that? Is there anything that you would like our team to know, that you would like to tell, somebody that you didn't know, supportive skill building is this, or, you really need to know that, about sort of supportive skill building? Is there anything that you feel really valuable that you would like to tell us?
One thing that I'm wondering about is just looking at the different sections of the policy. I know that primarily we serve a population under Section 21, and a lot of these are under in-home services as far as like Section 12, 19, and 96. So a lot of these don't really apply to the services because we do residential group home services. So that's why I don't have a ton of questions right now, because only a couple of these codes apply to us. But what audience are we looking at that are on the meeting today? And is that potentially why we're not getting a lot of questions from other providers? Is it that maybe that some of these codes and services aren't really targeted towards the people that are attending today?
It could be, that very well could be, because you brought up a good point about, you're primarily utilizing Section 21 when a lot of these services are in-home services under 12, 19, and 96. So, that definitely could be as well. Let me ask this, what codes do you primarily use in services?
Typically it's the T2016, so the group home code. I do use the G9007HI for behavioral consult. So that's why I asked that question on that one.
Okay.
But we don't really utilize a lot others that are on this list for this specific rate setting review.
Okay. And that is definitely helpful to know, as well. And I appreciate you bringing that up, Tammy. Because yes, that could be some of it. Definitely. All right. Is there anything anybody would like to bring up about supportive skill building services that you really feel like our team needs to know or maybe consider? And Tammy, I do have that as well, because I think that's important for our team to also know when thinking about these codes and using them. So thank you for that.
You're welcome.
If not, we'll go to the next question. Like I said, we can go back if need be. And Tammy, this kind of relates to, is there any additional information regarding supportive skill building services, the delivery payments and or codes that you would like to share? And you just identified it as a residential provider. That's something, like you said, we don't use a lot of these codes. We just use a couple of specific ones. So, if there's anything like that or any other information anybody wants to bring up regarding supportive skills building services, the actual delivery payments and codes that you would like our team to be aware of or know, please feel free. Or, again, a general question that you might have, or, or anything at all that you want to bring up, or maybe you're thinking about, please feel free to do so. And I think Emma has put the codes again in the chat. Caitlin, if you would like to pull that screen up again with the codes again, and we can pull up and show everybody. Tammy, also when you brought up about being Section 21, there may be some other of the sessions that you want to join. Please make sure that you want to check those out, because some of those may be more reflective of some of the services that you are providing or the codes that you guys may use. Certainly want to make sure everybody else on the call also checks that out, because that again may be something that applies to you as well, that you don't use a lot of these codes, but more some of the others. So definitely check out. I think we have 3 additional services that we will be doing in codes, and we'll again be going through a similar situation and questions and answers and looking at these as well, trying to get some of that general feedback and information from providers and the challenges in which they're facing, and things that our team needs to be aware of and know.
Yeah, I have signed up for the other ones because there are some potential services that we may, well, we're looking into providing, so other sections of policy, and that's why I attended this one too, just so that I can get a feel for the information that's out there and what other providers are asking for questions, and just to prepare us in being ready to provide different sections of policy that maybe we haven't either provided before or that it's been a long time since we've provided them. We're just kind of getting back into that. So thank you. I appreciate the
Yeah.
reminder on the other sessions.
Yeah, no, thank you. And I think you bring up another good point too, is, there may be certain codes that you've not used or utilized for a while, or because, things change, or, COVID happened, or whatever may have happened over the past several years. And so, there may be opportunities that you can use certain codes, like you said, that you can actually start using again, or need to know some additional information, or there might be additional services. So I appreciate you identifying that as well, because definitely each one of these sections have different pieces in them. So thank you for identifying that as well.
You're welcome.
Anything else anybody would like to provide regarding payments, codes, service delivery, for the supportive skill building service codes that we have identified here? Anything else anybody would like to bring up, or questions or comments, or, anything at all? Okay. Well, again, we need to go back. If you would like to reach out via email, please feel free to do so. Like I said, we get those emails. We'll respond back to those, get the information to you, and certainly log your questions, or have those questions for our team as well as the main team. So don't feel like it's going somewhere and nothing's heard, even after, or no one's seeing it or anything, because we are, and we do share it. Like I said, even if it's later on and the next week or two or month, or throughout the entire project, feel free to reach out to us. Caitlin has displayed the project email, which is main HCBS C and N at pcgus.com. So you can use that anytime. Also, as a reminder, the listservs, and that's how it's going to be communicated out, just like this session as well as other ones, or any future opportunities as well. So please sign up for any of those, as well as looking for the additional surveys or opportunities, as Kristen has identified, that will be coming out in the future as well. The comprehensive list of codes is Kristen put that out there. So again, you guys can go through that and look at that, and look at the remaining sessions. If any of those apply to you, please feel free to join. We'd be happy to have you and get any feedback. Like Kristen said, there's maybe other team members in your organization that you would want to join. Maybe they're more finance or billing people, or something like that, or maybe another leadership or provider sort of person that you want to get some additional feedback, or give them an opportunity to provide feedback. We would love to have them join as well. You can go out and they can register for the next sessions as well. All right. Anything else anybody would like to identify or bring up, or questions or address before we end this call? Okay. Well, if there are, like I said, there's plenty of opportunities that you can reach out later in the future, or other sessions. We do appreciate your time. Tammy, thank you for your time as well, and certainly, your questions and comments. Definitely appreciate those. And if Caitlin, you'll go to the last slide. Any other questions or comments before we end this call from anybody?
I just want to thank everybody for attending today, and we look forward to working with everyone.
Yeah. Thank you so much. Have a great day. Hope to see you on a future engagement session. Thank you. Bye-bye.
Have a great day.
Thanks. You too.